Good morning and welcome. Today I'm joined by Dr. Carol Zimbalatti, public health physician, and Louise Gagné, Director of Community Services, to give an update on our local COVID-19 situation, and Andrea McLellan, Director of COVID-19 Immunization Strategy, who will provide an update on our vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is a traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in this region. In the wake of the confirmation of 751 unmarked graves of children on the former site of Marival Indian Residential School, 215 children at Kamloops Indian Residential School, and the deadly terrorist attack against a Muslim family in London, Ontario, it is understandable that there are calls to rethink Canada Day celebrations. We encourage our communities to give pause on July 1st and thoughtfully reflect on our history of racism, oppression, colonization, and cultural genocide against Indigenous peoples, and commit to making reconciliation a part of our future together. Today, the province has shifted to step 2 of the roadmap to reopen. As part of this shift, outdoor gatherings of up to 25 people and indoor gatherings of up to 5 people from various households are now permitted. Additionally, essential and non-essential retail capacities increases. Overnight camps are permitted. Personal care services are reopening, and outdoor activities continue to expand. As we slowly reopen, it will be crucial that individuals continue to follow public health measures. Again, this includes wearing face coverings, washing hands often, maintaining at least 2 meters from others as required, staying home when you are sick, getting tested if you have symptoms of COVID-19, and getting the first COVID-19 vaccine available to you. As we continue to see our cases rise in our district, these measures, along with vaccination, continue to be our best defense against the COVID-19 virus. By working together, we can make the most recent shutdown our last. On Friday, the Public Health Agency of Canada released their recommendations for individuals who are fully vaccinated. It is important to remember that we must follow the rules and guidance outlined by the province of Ontario. The federal recommendations do not override the provincial ones. We are expecting the Ministry of Health to provide more information on this in the coming days, and will inform the public once more details become available. With that, I would like to hand it over to Dr. Zimbalatti and Ms. Gagné to provide an update on our local COVID-19 situation.
Thank you, Dr. Chirico. In the last 7 days, we had 42 new cases, bringing our total case count to 601, with 422 in the Nipissing district and 179 in the district of Parry Sound. The health unit currently has 73 active cases. There are currently 50 active cases that have tested positive for a variant of concern, all of which are the Alpha variant. Furthermore, 7 cases in our region, including 6 in the Nipissing district and 1 in the Parry Sound district, have tested positive for the Delta variant. However, all of these cases have resolved. Some new cases are still awaiting further testing. Currently, 7 individuals are in hospital due to COVID-19. As of today, 37 have tested positive for COVID-19 at the current North Bay Jail outbreak. An outbreak has also been declared at the Faith Chapel Christian Center in North Bay. 5 individuals have tested positive for COVID-19 and are currently self-isolating. The health unit is advising individuals who attended chapel services between June 13th and June 20th, I believe, to self-monitor for symptoms of COVID-19, and should symptoms develop, immediately self-isolate and contact the local assessment center for testing. The health unit has received a number of inquiries as to why an outbreak has not been declared in the underhoused population. The health unit has a responsibility to consider health equity in all its decisions, and the health unit perceived that there was a potential for increased stigma related to declaring an outbreak. So the benefits and harms of making such a decision were carefully considered, with some of the key factors being there was no one specific setting which could be linked to a potential outbreak. Cases were scattered throughout the community, making declaring an outbreak very difficult. There were also no additional measures that could be put in place to safeguard the vulnerable population or the general public by declaring an outbreak, as there was already a coordinated response by community agencies and organizations to address the increased risk in the underhoused and homeless populations, as well as other vulnerable populations in the community. The public and businesses have been provided with advice all along during the pandemic that they should be following public health measures and assuming that everyone outside their household has COVID-19. Lessons learned from another health unit that we consulted indicated that declaring an outbreak in an underhoused population increased stigma and caused the general public to relax in terms of how strictly they were following public health measures because they didn't feel that the increase in cases could impact them. The health unit's own learnings from declaring an outbreak in a place of residence, namely the Skyline Lands Law Department building, caused significant stigma to the residents, and they had difficulty in accessing many services due to this stigma. So overall, the health unit found that there would be no benefit to declaring an outbreak. There would be difficulty in determining which cases in the community belong to the outbreak, and there would be a significant potential for harm to the underhoused and homeless population, as well as the general public, by declaring an outbreak. Considering all this, the health unit made the decision not to declare an outbreak. As Dr. Chirico said earlier, it is absolutely crucial that we continue to follow public health measures in all of our activities and get vaccinated as cases continue to rise in our district. With that, I would invite Louise Gagné to provide an update on COVID-19 community outreach.
Thank you, Dr. Zimbalatti. As mentioned last week, the health unit continues to work with the North Bay Regional Health Centre COVID-19 Assessment Centre, EMS, and other community partners to offer mobile testing and vaccinations for individuals who may experience barriers to accessing these services, and this includes those with no fixed address. We want to ensure that these individuals have the same opportunity as others in the community to protect themselves from COVID-19 through being vaccinated. Through a collaborative effort among community partners, a temporary self-isolation centre is in place and has been in use for the past couple of weeks by individuals who are required to self-isolate, but are challenged to find a place to safely do so. We have already had several individuals successfully complete their self-isolation period through the temporary self-isolation centre. The self-isolation centre offers wraparound services to help individuals be successful in maintaining their self-isolation for the duration of the required time. Establishing an isolation centre that supports individuals appropriately 24 hours a day to maintain their isolation period for 10 or more days is quite challenging from a space and staffing perspective. The space needs to meet the client's needs, as well as the infection prevention and control requirements to ensure the safety of both clients and the support staff. An isolation centre also needs a sufficient supply of staff with different expertise in order for it to function effectively. A plan is underway to further increase capacity of the temporary self-isolation centre. To ensure the privacy and safety of individuals in need of an isolation space, details on locations will not be provided. Community partners and the health unit will continue to offer support and services to this population to support their health and to control the spread of COVID-19. With that, I'll hand it back to Dr. Chirico.
Thanks, Dr. Zimbalatti and Ms. Gagné. I would like to ask Ms. McLellan if she could give us an update on the vaccination program, please.
Thanks, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we are now at 73% of adults 18 years of age and older who have received at least one dose of COVID-19 vaccine, and 32% of adults 18 years of age and older who are fully vaccinated. Additionally, 52% of youth aged 12 to 17 years of age have received at least one dose of COVID-19 vaccine. As of yesterday at 3 p.m., we have provided a total of 115,155 vaccinations in our district. We are happy to confirm that as of June 28th, the province has opened up second dose bookings for anyone aged 18 years or older, provided that there are 28 days between first dose and second dose. With greater demand for the vaccine and an increase in vaccine supply presently, the health unit has opened up additional clinics and appointments. Individuals wishing to book their first or second appointment or reschedule their second appointment dose for COVID-19 vaccine can do so online by going to the provincial booking system at ontario.ca/bookvaccine or by calling the provincial call center at 1-833-943-3900. I encourage you to tell your friends and family about the vaccine clinics to help ensure everyone who wants a vaccine can get one. We remind everyone that Moderna and Pfizer vaccines are interchangeable and are both excellent vaccines based on the mRNA technology. Vaccine interchangeability is not new. It is a routine practice with vaccines. We ask that you get the first dose available to you no matter what the brand is. Youth who wish to be vaccinated before the first day of school in youth who wish to be fully vaccinated before the first day of school in September will require their first dose by early July in order to receive their second dose of the vaccine in mid-August. This will allow a 14-day period for the individuals to be fully immunized against COVID-19 after their second dose. Finally, I remind everyone that in response to the increased eligibility for the second dose and a current increase in vaccine supply, we have opened up additional appointments at clinics throughout the district. I also want to remind the public that our standby list is still available and people can sign up to receive their vaccine sooner if leftover vaccine is available. For more information on vaccine clinics or to put your name on our standby list, please visit www.myhealthunit.ca. Now I'll turn it back to Dr. Chirico.
Thank you, Andrea. So that ends our remarks, and we'll begin taking questions, and you can put them up in the box at the top of your screen, and please associate your name with it, if you will, please. And I'll turn it over to Catherine to start with the questions.
Thank you, Dr. Chirico. Our first few questions come from Stu at Bait Today and are for Dr. Zimbalatti. Will you give a more detailed timeline on the Faith Chapel outbreak? It was reported yesterday at the health unit cited an advisory between June 13th and 20th. Additionally, when was the initial infectious case detected and when was an outbreak declared internally?
Thank you, Stu, for those questions. In order to be able to declare an outbreak, we need to first establish that there is a linkage, an epidemiological linkage between two cases at a particular location. And then we count back to see when the individuals became cases, and then when the possible exposures could have occurred. And through this process, we determined that the earliest exposure that individuals at the Faith Chapel Christian Center could have experienced due to this outbreak was June 13th, which is why that date was established as the earliest date. And though it seems to be a long time ago, it is because of the process of counting back to when the earliest exposure could have happened.
Thank you. Our next question is for Louise, comes from Jennifer at the Nugget. I understand the health unit is looking at Canadore College residences to isolate the homeless. When is this going to happen and how many residences?
Thanks, Jennifer. As I stated earlier, for the safety of the individuals, we won't be disclosing any of the locations that we have been looking at to expand our self-isolation center.
Our next question is for Louise again, and is from Rich Coffin at Moose FM. How many spots are available at the temporary isolation space, and have there been issues around reaching capacity? How many more spaces are being created?
Thanks for that question. We have the capacity for just over 15 individuals at our current temporary self-isolation center. There have been, as I mentioned earlier, it's challenging to find locations that meet all the requirements to support the needs of the self-isolation center, and as well staffing. So if anyone is out there in the community is interested in supporting and has expertise in this area and is interested in supporting the self-isolation center, please feel free to notify the health unit and we'll connect you with the appropriate community partner.
Thank you. Again, another question in terms of the to this information, and it's for Dr. Zimbalatti from Eric at CTV News. The team at Hope's Outreach says it has been told by the health unit that colleges' residence buildings are being used as isolation centers for the city's homeless, as well as some has been taken to hospital with symptoms. Can the health unit confirm these details?
No, as Louise said, we do not disclose locations where individuals are self-isolating, so we will not be disclosing the location of any locations established as self-isolation centers, nor do we release case level information. So we do not, we will not be commenting on any admissions to hospital from any self-isolation sites.
Thank you. Another question for Dr. Zimbalatti from Jennifer at the Nugget. Jennifer asks, I understand the health unit is scheduled to attend Tent City today at 1 p.m. Why is staff going there?
I haven't been fully apprised of the details of that visit. I wonder if Louise has any details that she could provide.
No, not at this time.
Our next question comes from Tom at Radio Works Parry Sound. By not declaring an outbreak because of stigma, doesn't it undermine the very purpose of declaring an outbreak, namely highlighting the severity of the situation and bringing everyone's attention to it? Perhaps Louise would like to answer this question.
Yeah, that's, you would think that, thanks for that question. You would think that that would be the case. But in as Dr. Zimbalatti spoke to earlier, that hasn't been the experience that we've seen in previous communities. And in our experience with the Lancelot apartment, it served to further stigmatize that population, such that it cut them off from receiving services by community members who were fearful of interacting with those folks out of concern that they would be exposed to COVID-19. So there, as Dr. Zimbalatti said, and as I've mentioned, there's already a community response in place to support these individuals, and that's the work that will continue to move forward.
And I just wanted to add, as I mentioned previously too, that we should all be following public health measures and assuming that anyone outside of our household could potentially have COVID. So there is not, by identifying a certain population, it doesn't really increase or change what the general public should be doing.
If I may add to, if there's anything that we should be focusing on as a community to support these individuals, it is a sustainable housing solution, and that is very complicated, but a matter that would help with this situation.
Thank you. Our next question comes from Jennifer at the Nugget, and perhaps Dr. Zimbalatti and Louise would like to make comment. Why not identify how many cases in the underhouse populations, especially when cases are identified elsewhere, such as Faith Chapel and the North Bay Jail?
Yeah, I can start, and then if Louise has any additional comments to make. Like I mentioned earlier, there isn't one particular location that cases in the underhouse population can necessarily be linked to it, and nor are the cases exclusive to the underhouse population. They are scattered throughout the community and among different vulnerable or populations, as well as other individuals in the community. So declaring an outbreak is difficult in this setting, and defining who actually belongs to the outbreak is also difficult. And as there is no outbreak declared, it is a community issue. We can't really say that there are which particular number of cases are attributed to this outbreak or this increase in cases.
Thank you. Our next question is for Dr. Chirico. What is the message from the health unit regarding gatherings on Canada Day?
Well, thank you for that question. And again, moving to step 2, I think that it's really important to really use good judgment. We have increasing cases here, and we need to get control of it. So we were asking people to use really good judgment, follow the guidance from the province, and it's up to 25 people in outdoor gatherings. That is what is step 2 we've indicated. So we are asking the public to really take responsibility to try to help everyone limit the spread of COVID-19. We have the Delta variant that is spreading, and we need to get control of it. And we have to think back to lessons learned from previous resurgence of COVID-19. So we're asking people to really use good judgment.
Thank you. We have a question from Jennifer at the Nugget, and would be for Louise. Is the health unit concerned about the closure of the low barrier shelter and the added pressure this could cause on community services and required isolation centers?
Thanks, Jennifer. So that question would be better directed to the crisis center who manages the low barrier shelter. And the low barrier shelter has just been temporarily closed and relocated to a facility which will enable individuals to have better separation than at the low barrier shelter in the effort to reduce potential exposure to COVID-19. And so I would defer any other questions to the crisis center to be able to respond to that.
Thank you. Our next question is for Andrea from Eric Thompson at the Tribune. Have you given any incentive programs any more consideration to encourage residents to get their first dose of the vaccine?
Thanks for that question. At this point in time, no, we have not looked at specifically at incentive programs. We are having ongoing conversations on how to continually ensure that the public is aware of the benefits of receiving the COVID vaccine and encouraging people to make appointments for both first and second doses at our clinics. And so we will be also working with some of our community partners to develop strategies for some of those individuals who may not be able to access our mass immunization clinics.
I can just add to that as well, in that the Science Advisory Table has actually done a review of various jurisdictions where they have offered incentives such as gift cards or lotteries, and the results of that didn't indicate that they necessarily increased vaccination rates, and in some cases actually rates went down, though that might have just been the natural progression of cases going of vaccinations going down because fewer people were left unvaccinated who wanted to be vaccinated. But you know, we would consider various options in terms of how to increase vaccination rate. But it was interesting that that research did indicate that contrary to what you would think, incentives, especially financial incentives, didn't prove very useful.
Thank you. Our next question would be for Dr. Zimbalatti, and perhaps Dr. Chirico would like to add. Has there been any violations by local businesses as far as health measures through step one? This question comes from Stu at Bay today.
I don't believe any charges have been laid.
No, not to my awareness either.
Thank you. Our next question goes to Louise from Jennifer at the Nugget. Earlier you mentioned community response. Can you explain details about this community response? Who is involved, and what is it doing?
Thanks, Jennifer. Yeah, I just want to acknowledge that we've had significant community partner engagement in responding to in supporting our underhoused individuals in this situation. We have agencies from acute care sector, obviously North Bay Regional Health Centre, EMS. We also have agencies who have who's really it's in their mandate to support folks who are having mental health and addiction challenges, such as Nipissing housing and support services, mental health housing and support services, as well as the AIDS Committee of North Bay and area. We've had critical partners such as the Gathering Place, as well as our Indigenous Friendship Centre, North Bay Indigenous Hub, and many other partners, and I forgive me if I'm not including you all on the list. So it really has been a comprehensive community engagement table, including also more recently the City of North Bay. And with that, we have implemented, as I mentioned earlier, pop-up testing and vaccination clinics to provide increased opportunities for folks who are facing barriers to accessing regular testing services or our regular vaccine clinics. In addition, we're leveraging those partners who have day-to-day contact with these individuals, through their outreach efforts and support, to contact them if we identify them as a high-risk case, or if they're identified as being a positive COVID case, connecting them to a safe place to self-isolate, or asking them if they need a place to self-isolate, and then supporting them in the self-isolation center. And as I mentioned earlier, the self-isolation center is providing a number of wraparound services in order to help these individuals successfully maintain their isolation period. And for anyone in the community who has actually had to go through a self-isolation period, it can be challenging, even when you have all the supports around you. And so it's no different for these folks as well. And so we're just making sure that they're well supported, and that they get through their isolation period and can return to return to the community.
Thank you. Our next question is for Dr. Zimbalatti from Clark at Cogeco News. Is there case management being conducted at Edgewater?
Again, we don't release case level data, and so I would defer any questions on that.
Thank you. Our next question is for Dr. Chirico from Tom at Radio Works Parry Sound. Considering the rise in cases prior to step 2, how fearful are you of an accelerated rise in cases now that things are opening up?
I think that fearful wouldn't be the word I would use. Concerned, yes, but also optimistic. Our communities in our district have done an incredible job throughout the pandemic to do what needs to be done to turn the situation around. And I think that we can do the same. I think that we're not out of it. To be realistic, we're not out of it yet, and we need to continue to follow public health measures and get as many people vaccinated as soon as we possibly can. And that will help turn things around. So people need to continue to be vigilant. And that I think it also underscores that we really need to take the time before we progress to the next stage and the next step, step 3, that we follow what has been outlined and reassess the situation and wait the 21 days before progressing.
Thank you. Our next question is for Louise from Jennifer at the Nugget. These isolation center, if they're located in businesses such as hotels or motels, are guests or public notified for full disclosure?
Thanks, Jennifer, for that question. No, we don't release where self-isolation centers are in place. These are fully supported self-isolation centers with infection prevention and control measures in place. It's really no different to any other hotel or Airbnb being used by an individual to self-isolate. And at this point in time, we are not disclosing that.
And I'd like to add too that the message doesn't change. People need to be assuming that everybody they come into contact with assume that they have COVID and take the necessary personal precautions with anybody. So it's not necessarily whether or not they're there for that particular reason of self-isolation or not. So I think that there's lots that we can learn to help protect ourselves, in addition to becoming vaccinated.
Thank you. Our next question would be for Dr. Zimbalatti, and perhaps Dr. Chirico would like to add. And it comes from Stu at Bay Today. How many positive cases have previously received a vaccine dose? Is this tracked?
Yes, we do track vaccination rates among our cases. To date, in terms of COVID cases, since vaccination began in December 14th in the province, we have had only 2 cases that have been fully vaccinated that have subsequently developed COVID-19.
And I'd also like to add too that on the other side of it, we were seeing that those that were positive, there's almost 3/4 of them were not vaccinated. So it really speaks to how effective vaccinations certainly are. And that's why we really encourage people to get vaccinated. And in addition with public health measures, it's our best defense.
Thank you. This will be our last question and will be for Louise from Jennifer at the Nugget. Are part of those services for the vulnerable populations, including COVID-19 vaccination? Can you say what the uptake is?
Yeah, thanks, Jennifer. As I mentioned previously, we are having pop-up testing and vaccination clinics, and it is also part of the self-isolation process as well. We did have a vaccination clinic, and Andrea can speak to this as well, earlier in the year at a low barrier shelter where we reached a proportion of the population. And I would say the uptake is increasing, just like any other population. There perhaps was a little bit of hesitancy at first, but through seeing their peers vaccinated, we're now seeing a greater uptake. And so I would say we have a fairly good proportion that have at least had their first dose. And now we're working on getting the proportion with their second dose and increasing that. Andrea, is there anything else you'd like to add to that?
No, we continue to work with our community partners to ensure that there is access for these vulnerable groups to vaccine in additional ways other than just the through mass immunization clinics that may not be an appropriate option for those individuals to attend. We began working and offering vaccinations to these groups back in April. So it's been an ongoing process throughout the pandemic.
Thank you. That was our last question. So this will mark the end of the press conference. We will resume with the press conference next Thursday as part of our regular schedule. Thank you everyone for joining, and have a wonderful day.
Thank you.